Adult congenital patients always present a unique challenge. Each one is a little bit different. Nick is a patient who had an arterial switch at about 2 weeks of age. It's better than an atrial level switch in terms of the long-term outcomes, but no one really understood that dilation of the neo-aortic root would be an issue. He had very good follow-up, very involved family, and had an essentially normal lifestyle through childhood. In his early 30s was found to have some dilation of the root, and this progressed over the course of 3 or 4 years to the point that he had an aneurysm that was almost 6 centimeters. And so this was the impetus to refer for surgery. Initially, he was told he would need a replacement valve, and this is what led him to do some research online and found us for the option of a valve-sparing repair. So for Nick, we did a reoperative sternotomy. We were able to divide the main pulmonary artery portion of the Lecomte reconstruction and preserve the branch pulmonary arteries, which are always a challenge in these cases. And we did a valve-sparing root replacement with a Valsalva graft and reimplanted the coronaries, which are always a little bit high, sometimes a challenge, but in his case, the anatomy worked out very well for the valve-sparing. He has a competent valve and left the hospital in less than 5 days. So our expectation is that he has an excellent prognosis, essentially will have a normal lifestyle. So the Adult Congenital Heart Disease Program at Northwestern with Lurie Children's is truly a partnership. We have a bi-monthly meeting that brings together all of the experts on both sides in imaging, in clinical cardiology, in heart failure, and from the surgical side, and with all of our support staffs. And we believe that the complementary expertise of the adult surgeons and the congenital surgeons is what lets us do these operations as safely and effectively as possible. And in the case of a patient who would benefit from something like a valve-sparing repair, doing that in a patient with a congenital reconstruction is a little bit different, obviously, from doing it in an adult patient. To us, it makes perfect sense to have that collaborative approach carry through the operating room. And that's why we have a surgeon from both sides involved in most cases. And the ability to have the two hospitals literally across the bridge in proximity means that we can take care of these patients in a way that utilizes the expertise and the strengths of both institutions in a way that I think is pretty unique.